Every Thursday, let's get skin to it with dermatologist Dr. Sandy Skotnicki and personal stylist and beauty enthusiast Marlo Sutton for a new episode of Skin to It, where we guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Skin to It, a podcast brought to you by Bioderma. Welcome to Skin to It, your guide to healthy skin. I'm Dr. Sandy Skotnicki, board-certified dermatologist.
And I'm Marlo Sutton, personal stylist and beauty enthusiast.
So welcome back, listeners. This is a really great episode on hair loss. We're going to teach you everything you need to know about hair loss. And is it more common? Is it becoming more common?
Yeah, well, I'm really interested and I'm really excited to discuss this topic with you. I deal with a lot of clients who are in their 50s, 60s, 70s, and it's a big topic right now.
Mm-hmm.
So I think one of the misconceptions is that people don't realize when they are dealing with hair loss issues is that they do need to see their dermatologist.
Yeah, I mean, it would be great for everybody to go to the dermatologist. We are limited. I think that's why some of this information is a part of the reason we're doing this podcast is to disseminate some information in bite-sized amounts. Yeah, I mean, it's a dermatological issue. We see it a lot. We saw a lot during COVID because of hair shedding and stress from COVID.
Right. So, Sandy, is it more common before? Because I'm definitely talking about it a lot more with people around me.
Mm-hmm. Well, I mean, if we just talk about some stats, we don't have Canadian stats, but over 80 million Americans in some studies that I reviewed complain about hair loss. You know, the average 2/3 of men by the time they're 35 will say they have some hair loss. Women as well, about 40% of American women complain about hair loss. So it is very common,
Right.
but
Is it common or is it more our awareness around it that is making us seem to like it seems to be kind of everywhere?
well, I think that's the whole point. And like it is very common, but people's awareness of it is the fact that, you know, they see it on TikTok. Like my sons have they're in their 20s and they're like coming to me with and they're all their buddies like we think we have hair loss.
Mhm.
And I don't know that when I was first graduated just 27 years ago, I didn't see 18-year-olds coming in and asking me about hair loss.
Right.
And they probably had some, but it's that, you know, when you were pregnant, everybody seemed like pregnant and everything seemed like everything was pregnancy related. And you're like, you never noticed that before. So, and there's that phenomena. It is a phenomena where you get a false impression that something is happening more frequently because you are more aware of it. So I think that's part of it. But I do think hair shedding increased during COVID, and we'll get into that a little bit more.
Absolutely. So, hair is really integral to our sense of who we are, our personality, it could be our security blanket, part of our self-esteem.
Mhm.
But before we get into it, our listeners would really benefit from a short definition of the hair cycle and growth.
Yes, that's very important. Good place to start. Well, our hair cycles, it goes through this growth and rest phase. So the technical terms, anagen is a growth phase, and our scalps are about anywhere from 2 to 6 years. You ever wonder why your eyebrows don't grow down to the floor? I mean, there's different lengths of antigen, so our anagen phase for different hairs.
And eyelashes, I'm guessing.
Eyelashes too, yeah. And then so catagen is the sort of transition phase, and then telogen is a very important word. We'll come back to it again. It's shedding of the hair follicle. And then it's interesting, once the hair bulb goes into that rest telogen phase, it then takes 2 or 3 months to actually exit. So that's called the exogen phase. So, and that's important when we'll come back to that sort of shedding hair losses and the timing. So it is normal, just to finish, to lose about 50 to 100 hairs a day through the shedding.
Okay. So from what I understand, there's different types of hair loss. So can you give us some examples to really make people understand what we're talking about?
So there's 4 main types. We'll talk about each in turn. So the first one is the most common one is a hereditary type that we call androgenetic alopecia, or male and female pattern hair loss. And androgen is a male hormone. Most people will understand testosterone, and the form that really is associated with this type of hair loss is the dihydroxytestosterone, or DHT.
Okay.
And yeah, about sorry, go ahead.
Sorry. So my question was, is this going to also be triggered by menopause?
That's a good question, actually, because when I think we're both menopausal.
Totally.
Full disclosure here.
Completely.
And so because we have estrogen, which is the female hormone, and you know what? I want to make a point here that I was listening to, remember we look at some TikToks before these episodes. There was this one that was incorrect that said that This type of hair loss, androgenetic hair loss, is because women have too much estrogen. That is completely wrong. Okay. It's that I always tell people, my patients, that estrogen and testosterone is sort of a seesaw. So when your estrogen is high, your testosterone is low. So when you go through menopause, your estrogen is down.
Lower.
And so your testosterone is effectively in the pool more available, but you don't have more, like you're not producing more. So
Okay.
it's again these nuanced explanations that you don't get in a 1 minute reel.
And that's why we have you.
Exactly. So the next most common cause of hair loss, and actually it really shouldn't be called a hair loss because it's hair shedding, is called telogen effluvium. And that comes back to that hair cycle where 10% of our hairs are kind of in this, resting phase and they shed, and that is equates to about 100 hairs a day. So
Yeah,
yeah.
yeah. Well, that's definitely something I've been suffering with, and we'll talk about that a bit later. And I have a really good friend who's lost probably half the volume of her hair.
Is she going through stress?
Yeah, and and I think it's that stress is obviously such a huge factor in this, and it's such a hard thing to combat because it's like a vicious cycle.
Yeah.
Right? You stress about losing your hair and then you lose more hair. And then you have other stressors that combine with that.
Well, that's so
So,
true. It's true because the more you lose your hair, the more stressed you get. I want to
yeah,
make a really quick, because I actually tell my patients this, and I forgot about this. I say that you don't need your hair to survive,
right.
right? Although hair is very, very important for us
You like it?
cosmetically.
Like it?
But so when your body, and this is a very crude way of explaining, but when your body is under stress, your body's kind of shutting down what it doesn't need. And so it's diverting sort of energy away
Energy.
from, you don't need your hair. So you're going to go into this, more of your follicles are going to be pushed into a rest cycle. There's also some dietary factors, which we can get into. But the third most common cause is immune related. Most people will have heard of alopecia areata, where your body is actually attacking the hair follicles. We don't really understand what the target is, but that is under the autoimmune sort of group of diseases. There's other inflammatory conditions like lichen planopilaris and frontal fibrosing alopecia, which we won't get into.
Okay.
And that's where a biopsy of the scalp is very important, and you need to see a dermatologist.
Right.
And then the last type is traction. So if you wear braids or a hair extension, the glue and the clips, a tight bun that you wear all the time, that
That pulling.
it pulls the follicle, and the follicle ends up slowly dying, really
Right.
fibrosing.
So, Sandy, can you actually have two of these issues that are happening simultaneously?
Yes, yes. You know what happens a lot, and we saw it again in COVID, was so you have a woman who maybe has mild the genetic hair loss, like the androgenetic hair loss. So they have it mild, so you can't really see it
Okay.
because we lose more hair that way as we age.
Okay.
So then they go through a shed because of they got COVID, they had a high fever from the vaccine or the financial stress or the whatever stress, and then they shed and they kind of uncover that hereditary hair loss because hereditary hair loss is sort of patterned. In male, it's on the
Crown.
vertex crown. Women, it can be sort of all over thinning, but also on the crown area. Men can just be temporal. So it is. So you can see both.
Mhm.
The immune ones, not so much. Usually they're pretty separate. Yeah.
Right, right. So a lot of these sound like they're, stress related. So I think I'd love to talk about some ways to prevent this type of hair loss
Well, I don't know that you can. I mean, I don't know, but we were chatting about our own personal experiences.
experiences.
I mean, I've had 3 children, 2 through very dramatic C-sections, and then I've had 3 sort of dramatic surgeries, and I lost probably half of my scalp hair each time, but each time it grew back. So
Right.
that's that telogen effluvium. So technically, it's not really hair loss. However, like you were talking about your friend, if the stress continues, and we were getting a little ahead of ourselves but with treatment, but you have to check iron and different things. If the stress continues, the shedding doesn't really stop. And
Yeah.
then your volume of your hair can go down.
Right. I mean, a lot of people talk about in menopause and noticing changes of their hair, whether it's thinner or just even the texture.
Mhm.
But I know I went through my first hair shed when I was in my 20s, even before I had kids. And, at the time I was living far from home. I was most likely a little stressed out.
Mhm.
And I was also not eating well. I had lost a lot of weight,
That's a big thing.
which was huge. And I had this shed, and I couldn't believe it because I always had very thick, very curly hair. And then I went through it again recently, probably 6, 7 months ago, 8 months ago. Same thing. And, you almost feel like you wake up one day and half your hair is gone. So,
Yeah.
and it is slowly coming back. And
Mhm.
we're going to talk about some really interesting things that, and I've been trying some of them. So,
Actually, I wanna make a point there, a really important point of some of the reasons you can have stress shedding. Number 1, Marla just said, move away from home, social stress, you miss your family. If you have a car accident, if you have a car accident, that's a
any
major stress
trauma.
on the any trauma, death in the family. If you move, you lose your job, you lose a baby, you get divorced. I mean, COVID, high fevers,
Right.
anesthetic,
Anesthetic.
so then 3 months later, which is very important, it's 3 months later that you shed the hair because that bulb goes into like a flight and fight response, gonna shut down.
Okay.
Then you got 2 months before to sort of fall to go up to the top of the skin and then exit. So, yeah.
Yeah, that's really, I didn't know that till really recently. So I think we want to get into the next stage, which is treatment, like
Mhm.
the next part of our conversation, because there are a lot of really interesting treatments and a lot of new things that have come along. So once hair loss is starting to occur, depending on the type, what are the possible treatments? And then if you see someone in your office, like what are you assessing? What are you looking at? What do you recommend? And we can start maybe even by talking about Rogaine because that's a one that we're minoxidil, Rogaine, we're hearing this all over the place. So
So
what are
yeah,
your
well,
thoughts?
definitely. So I think what I find really sort of frustrating when I see patients in my office is they come with a lot of preconceived notions of something that's going to work for their hair loss, and I always take it back to, as I always do, the science. Okay, not every type of hair loss is the same. So
Right.
not all treatments are going to work for the same thing. So
Mhm.
that's why we talked about androgenetic alopecia, telogen effluvium, and immune related. You're not going to use the same treatment for immune related as you do for hereditary hair loss. So let's talk. First thing I do is take a history. Do they have trauma? Have they had their thyroid checked? Thyroid can cause shedding. Is their iron good? Because iron can, you need, one of the things with shedding is you need good soil for that hair to grow back. That's kind of how I explain it to
Right.
patients. And if you don't have the right soil, which is iron, B12, zinc, then you don't have the right nutrients to actually grow the hair back.
Okay.
So we take a history, we do some labs, and I often biopsy. Sometimes I biopsy for patients' peace of mind because they're coming. I look at them, and a lot of people say, "You only looked at me for 2 seconds." Well, I see the pattern.
Mhm.
I know what I'm looking for, and it's very common. But if I really want to make sure that I'm not giving an oral medication for something that isn't present, in particular androgenetic alopecia, I'll do a scalp biopsy.
Okay.
So let's break down the treatments. You talked about Rogaine.
Mhm.
So Rogaine is a trade name. The drug in Rogaine is called minoxidil.
Minoxidil.
And minoxidil, interesting story how it was discovered. It is a blood pressure medicine. So men were put on it to treat their blood pressure, and they were like, "Hey,
My hair is growing
my
back.
hair's growing back." So then that's how that all started. And Rogaine, we should say minoxidil topical has some of the most robust studies for hair growth out there for both women and men. So it is a no brainer. The problem with it is it's a drag. Like you have to put it on twice a
Right.
day.
You
I
can't and you
reckon
can't stop.
you can't stop. So actually, how does it work? So Rogaine, so minoxidil, I should say, I always say minoxidil, um, increases blood supply to the follicle. We
Okay.
don't really understand completely, but we think when you increase the blood supply, hair follicle, what's happening in androgenetic alopecia, we never really even talked about that, is the follicle is actually miniaturizing.
Okay.
So in response to dihydroxytestosterone, the follicle is miniaturizing. So you're not shedding any hair. And that's one of the first questions I ask when people come in. I say, "Are you shedding hair?" And they'll go, "No, my hair is just thinning." So that means they have the male pattern, female pattern hair loss because you don't shed hair with that condition.
Right.
The follicle actually miniaturizes. So what minoxidil is doing is increasing the blood supply. So you're kind of feeding. Think about like again feeding the garden with this, and if you take it away, the hair then starts to miniaturize again.
So I've heard of people starting minoxidil and then having to shed.
Yes. So the other thing that minoxidil does is it pushes follicles from a rest phase. So you've got a follicle sitting there in that telogen rest phase, and it pushes that follicle into a growth or an anagen phase so that you will shed that old hair.
Okay.
The other thing is using something called ketoconazole shampoo.
Okay.
So that trade name is Nizoral.
Great.
And there's some soft evidence that shampoo can decrease dihydroxytestosterone on the scalp.
Nice.
Then we have finasteride, which is a drug that lowers DHT. So if you have less of it around, you can't miniaturize those follicles. So that is a pill. It's usually a 1 milligram.
Okay.
Then there's something called PRP, which is plasma-rich protein. You
A
take
little painful, no?
it is needles in the scalp, and the studies are there, but they're not as robust. It costs money. It is painful. That we don't know how deep to go for sure. We don't know how often to do them. But I do it in my office, and I've had, anecdotal really good responses with,
And
yeah,
what about I have also a friend who has one of these like light caps, like infrared
right.
caps.
So those are called low-level laser therapy. They come in combs and caps. Thing with those, there's some study, there's some evidence. It's not robust, but in particular, red LED light will stimulate the hairball to grow. Problem with these is you have to use them all the time. You can't just use it willy-nilly. They don't.
Once.
No, it doesn't work like that.
Okay. And
Yeah.
then Sandy kind of always laughs at me because I'm on TikTok once in a while. So what about rosemary oil? Because that seems to come up a lot.
Yeah.
People say it's as good as minoxidil. Is that true? What
So
are people saying?
yeah, one of the nice things about anytime you do a personal learning project, we call them in medicine, which is a podcast, is that I have to review all the data. And I did. I reviewed this rosemary oil, which I was like, at first, I was like, there's no way. But there is some small studies. So we talk about something about power of the study. So if you've got 40 people, that's a very low power.
Right.
If you've got thousands of people, that the results from that study are going to mean a lot more. So the studies with rosemary oil were on like 40 people.
Okay.
Okay. They were double blinded. 26 had got the rosemary oil twice a day, and the other, I don't know, 14 didn't. And in 6 months, they did show some improvement, comparable. Actually, they even compared it to minoxidil at 5%.
Wow.
So here's the caveat: you have to use an oil in your head twice
and
a
it's probably
day.
very strong smelling.
Yeah, twice a day for 6
Yeah.
months. I mean, go for it. I'm not doing that. Yeah.
So let's switch gears because we talked about both of us having this issue at certain points of our lives. So let's talk about hair shedding and how we're going to treat that.
So, well, hair shedding, again, is this condition called telogen effluvium. And technically, it's not hair loss because you have the ability for your bulb is still there. Your hair bulb is healthy. It's in a rest phase. It's fallen out. Now the bulb has to regrow. So the most important thing I find when I have patients come in and I ask the history, and if they say, yes, I'm shedding, it's coming out in clumps.
Okay.
And that's, I will ask more questions. I might do a biopsy to rule out if they have concomitant androgenetic alopecia. Like you said, you can have both.
Okay.
But I tell them there's no on-off switch here. The bulb has to be pushed back into a growth phase. So how do we do that? Well, we check the most important thing I found with telogen effluvium is a patient's iron level. So again, if you think about you've got this empty bulb, it wants to grow hair, it needs the right soil, you need iron. And a lot of women, menstruating women, they'll say, my iron's normal. I'm like, yes, but the range for iron, it depends on which country you live in, is a big range. It's 5 to 200 in Canada, somewhere around there. So if you're at 30, sure, you're normal. But if you want, all we have to do on many patients, especially if you're vegan or pescatarian and you're not having a lot of meat protein that's giving you iron, is start them on iron supplements.
Right.
Little trick about iron supplements. Have you ever had to take them?
I have.
Pretty nasty.
It's nasty
Yeah.
and can constipate you.
Exactly.
Yeah.
So the trick around that is most of these patients are not iron deficient. They have low normal levels.
Okay.
So you don't need to take it every day. So there's various forms. I like Palafer, Ferromax. You take 300 milligrams 2 to 3 times a week.
Okay.
Get your stomach a little used to it. You can also take liquid iron. It's elemental iron that bypasses the metabolism in the stomach. So you can do all these things, but when people say I can't take iron, I go, it's hard for me to stop your shedding. I need you to get on some iron, especially if you're low.
And what about this fear of people washing their hair more often? Because, like you said, every time they wash their hair, they're seeing it come out like so much hair. So it makes them afraid to even wash it.
That is one of the most common things we get asked. People bring in their bags of hair.
Wow.
Okay, so what happens? It's human nature. First of all, go back to hair cycling. We talked about the fact that you shed about 50 to 100 hairs a day.
Right.
Most of that hair is going to be shed when you are in the shower. because it doesn't come out without a bit of a tug, right? You've got this hair that's in the rest phase, it's ready to come out. But so when you're washing your hair, that's when the majority of those telogen shed hairs are coming out. So if you wash your hair every 2 days, you're going to lose about 200 hairs.
Right.
If you wash your hair every 5 days, that's 500 or more hairs. And you're like, and it
700,
looks like it's more, but it's actually not. So a very important thing, if you're shedding hair, wash your hair like you normally do. It doesn't make any difference. That hair is going to come out anyway, no matter what you want to do. I want to just make sure that we don't forget to, with respect to treatment of telogen effluvium, check the iron, check the thyroid. We also will use topical minoxidil in chronic shedders to push those resting follicles into a growth phase. Remember how we
Okay.
said that's what it does?
Yep.
That's why you get some shedding. And then we
Of
do
course, I
also
remember seeing this. I'm right here next to you.
and then we also can use PRP for extreme shedders
Okay.
to just try to stimulate. We actually didn't talk about how PRP works for hair.
Okay.
So PRP is plasma-rich protein. So if you sprain your ankle, I think I said this in another episode, that swelling is your plasma.
Right.
So that plasma is full of healing stuff and growth factors. So there's studies to show that the factors in the plasma-rich protein can stimulate the hair follicle, increase the blood supply to the hair follicle. So it's not just wishy-washy. There is some science. Again, it hurts and it costs money. Mind you, you should never let pain discourage you because we have all kinds of pain stuff, to laughing
Pain
gas to
relievers. Right.
yes,
Yes.
to
Pain.
drugs.
Okay. So the last one we are going to talk about is alopecia areata.
Mm-hmm.
And this is the immune one.
Mm-hmm.
And Sandy's going to talk about some interesting information
Well,
on
you
that.
didn't even know that. Like you said, are we going to talk about this new drug? Like this is very exciting. We have a new drug to treat this. Let's digress and talk about alopecia areata. Areata is just a Latin word that means area. And by the way, alopecia is just a word that means hair loss. It's not diagnostic in of itself.
Okay.
So it's kind of a silly word because it doesn't really tell you what it is. So again, we already discussed that the immune system sort of attacking the hair follicle. We don't know why. We don't know what it's attacking. And you can get circles, so areas. That's the most common presentation. But some people can lose their whole scalp. We call that totalis. And some people can lose all their body hair. That's universalis.
Okay.
So let's just get to the new drug. I mean, up until this drug, we injected people with some hydrocortisone into the scalp. Hair grows back, but then it sheds again. It's a very frustrating treatment
Right.
to give and for patients to receive. And also just the treatment of this condition is frustrating as a dermatologist. So the new drug is in Canada, it's called retilacinab, and it is a pill. There's another one, baricitinib. These are JAK inhibitors. Basically, these are medications that interrupt cell cycle signals in inflammation. They're anti-inflammatories, but they're a pill. They've been around for quite a while. We use them in eczema. We use them in psoriasis. They're used in inflammatory bowel disease. So if you have significant alopecia areata or you've suffered from it for years, you can see your dermatologist to get on one of these drugs.
Yeah, that is amazing. And
Yep.
it's like so hopeful, right?
Mhm.
Really incredible. So I think we want to end it with talking about some supplements.
Yeah, the most controversial area.
Well, and and I do have quite a few friends taking actually Nutrafol, which I know we'll talk about in a second. But I guess
And is it helping them?
yeah,
Yeah.
absolutely.
So there's an anecdotal case right there. Like,
for
do you have
sure.
any friends?
Well, and one friend in particular, I mean, I have a few, but one friend in particular took it for a while, noticed some results, but then stopped.
Yeah.
And then she realized that
It was helping.
it really had helped her, went back on it, and now is really being diligent with it. And it is making a huge difference. Her hair looks really a lot fuller, and it's growing in. You can even see where it's grown in.
Oh, cool.
Yeah.
I think that's an important point, which one that we've made throughout this episode is that if you want to do, like, whether it's an LED light or, supplements or or rosemary oil, for God's sakes, you got to use it every day. Like, you can't just do these things willy-nilly. So Nutrafol. Nutrafol, I reviewed all the evidence. I actually really not 100% sure what it says. Active botanicals, potent anti-inflammatories, adaptogens. We're going to talk about that in a mushroom episode. These are chemicals from plants and mushrooms that decrease stress in the body. And I think the most important part of this supplement is something called SAW, SAW palmetto. It comes from an herb a First Nation herb, a bush, I think, a fern, I'm not sure. And it decreases DHT, again, that dihydroxytestosterone,
Right.
and it has some other vitamins and things. The thing for me, as with most physicians, is we want to see studies.
Sure.
So they do have, again, small power, not like thousands of people, but they're decent studies, double blind, randomized controlled to show that they actually grew some hair. And we've got cases, like I've got patients who use it, you've got friends.
Yeah.
So I think if you have the money, because it is expensive,
Yeah.
it's worthwhile, but you have to take it regular. Then the only other one is
Viviscal.
Vivisco. And again, I'm not sure exactly how that's working. It's a marine supplement, and they have some clinical studies, again, double blind, randomized control, low power, but I have suggested that to patients. I don't suggest the shampoos and all this stuff. I suggest the supplements.
Okay.
And again, something to consider, not harmful in any way, but can be expensive.
Right. Right. And then biotin. What about biotin?
So biotin, the studies are not very robust. You have to be deficient in biotin to take a biotin supplement to actually have it help you.
That is
Biotin,
not common, I
not
guess.
common
Okay.
in our the place in Canada or North America. It may make the hair you have stronger,
Right.
but it's not growing hair. I think that's a common misconception. And
Okay.
if you take too much biotin, it can actually interfere with the measurement of your thyroid hormones.
Okay.
That's actually been a problem. There's some studies written about that. So yeah, I think you get enough biotin in a multivitamin.
Okay. Okay. I understand. There's so much information that we just talked about, and I think it's a lot to take in. And it's so topical and relevant right now.
Mhm.
Really, really interesting. Thank you so much for doing all this amazing research. Yeah, I think I'm gonna try Nutrafol, to be totally honest.
Yeah. Well, I think what I just like to say that it's nice to have a place where you can get all the information in a 30-minute sort of soundbite and dispelling some myths, giving you the actual names, questions that to empower you to go to your physician and and ask for this or that, or I want my iron level checked, or now you know how to take iron if you have normal iron but you want to increase your stores. So thank you so much for joining us. I hope you
Thank you.
learned a
Thank
lot,
you.
and we'll see you next time on Skin to It.
Yes.
Catch us every Thursday for a fresh, exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin. Skin to It, a podcast brought to you by Bioderma.